Hi guys, Adam here. Just following up from the article I published on my website 2 days ago. Now, I will give you the two assessments towards the end of this video, but if you haven't read the article, I'll quickly just do a recap for you. The article was about pain and training, and specifically more lower back pain and training. And the overriding message that I wanted to get across was to not accept pain as an outcome of training. We're in the gym, we've got goals, we want to get fit, we want to get strong, want to improve our muscle mass, all of the above. And if you're getting injured, you're moving away from your goals. So I think it's really important to understand that we need to assess, and if you're getting pain, there's something that's going wrong, whether it's a tissue buildup, whether you're not meeting the positional demands. You need to, whether you go see an exercise physiologist or a coach or just someone who understands movement, or you do the requisite research yourself in that area. And that brings me to the point of the reason why I'm giving you these two assessments. These two assessments, generally speaking, are the key. I find a lot of people fall down in these two areas, and that is the reason why I'm going to give you these two assessments. The other points in the articles I spoke about is just a couple of tips. You can, just to check your technique, record your exercises and perhaps even upload them onto Instagram like I do. And you can tag me on Instagram and I can give you some feedback on what you may or may not be doing wrong, areas that you might need to assess. Now, which brings me to the two assessments which I'm going to take you through today. The first one I'm going to take you through is thoracic spine extension. Now, there's a million other assessments we could do, but this one's a big one. So I'm just going to quickly show you how you assess the thoracic extension. So if you're just standing on the side, it's probably a good idea to actually record yourself while doing this one, or you could get your friend or someone to assess. What you're looking for here is thoracic extension. So it's just a fancy way of saying for you to have the ability to extend your thoracic spine. Now, the thoracic spine, for those of you who don't know, if you just palpate where the bottom of your ribs are, that is where your thoracic spine starts. And then if you run your hand down the back of your neck, there's a bony prominence, one of the spinous processes sticks out, and that'll be generally your C7, and that's the end of your cervical spine, but the start of your thoracic. So you're looking, for me, it's from about there to about here is where my thoracic spine is. And that thoracic spine should be able to extend. And what we're looking for here is between 10 to 15 degrees of extension. If you do not have the 10 or 15 degrees extension, it's not the end of the world. There are things we can do to increase that. But generally speaking, this is an area that we need to assess. So I'll just quickly show you. So with one hand, I want you to put on your lower back. The other hand, I want just maybe 5 centimeters or less, just out from your chest. And then I want you to take a deep breath in and then exhale. And then I want you to see if you can lift your chest into your hand without using your lower back. That's why I'm going to get you to put your hand on your lower back. If you feel your lower back moving, you're cheating. And generally when you see people and they don't have thoracic extension, they're doing things like a shoulder press, they will inevitably get lower back pain just because they don't have that thoracic extension. So just a simple one, and you're only looking for, maybe 5 to 10 centimeters. If you're getting under that, then there's a couple of things that I'd suggest you do. I'd get a foam roller, and you can even just do like a vertical lie on a foam roller, or you can do a horizontal lie where you're trying to teach your body to go into extension. But even if you just Google how to increase thoracic extension, you'll see a million articles, you'll see a million videos on that on YouTube. Now I'm just going to change camera angles for the second assessment.